Hi, I'm Dr. Scott Saintamore.
And I'm Dr. George Vorogu. We're both from RBK Pediatrics, and today we're going to speak to you a little bit about the RBK anticipatory guidance and safety videos.
So thank you for taking a few minutes to talk with us. We hope you enjoyed your 6-week visit with us. And so this is another video just to help prepare you and show you what to expect when you come on in for this visit. So at about 10 weeks old, things get a little bit easier with your newborn. When we talk about things like feeding your baby. Previously, you've been feeding your baby every 2 to 3 hours, all through the night and all through the day. At about this age, they start sleeping more through the night. So the advice becomes, if your babies are sleeping and they don't wake up, you can let them just sleep. If they wake up and start crying, fill a bottle, bring them in and feed them. You're going to have more of an idea now about your baby's feeding habits, how much they take, what they look like when they're starting to get full. So pay attention to your babies. Nobody knows them like you guys do. So use that. When we talk about infant safety, what are some of the things that you like to talk about at this age?
Well, the safety is usually related to dropping the baby or the baby sleeping in on its belly. Some safety tips are very, very important. Everybody's using a car seat. The car seat needs to be rear facing and in the back of all cars. When you put the baby to sleep, you should always put the baby to sleep on its back in its own crib, not in your bed, because unfortunately I had seen some issues where the mother would roll over on the baby and suffocate the baby. And the baby should really sleep in your room until it's about 5-6 months of age. In regards to water safety, make sure that the water is not too hot. You should try to set the water heater of the house at below 120 degrees Fahrenheit. And a very important thing that I've seen a lot of over the years is leaving the baby on a changing table or leaving the baby on a bed. People think that they can put the baby in the center of the bed and, baby will be okay. I know they can't roll over yet, but somehow they wiggle and they jiggle and they make it to the side and then gravity kicks in and they fall down. Mm-hmm. And once again, never leave the baby alone in the bath water.
And remember, we call these accidents because we don't intend for them to happen.
Now, we have some things that are going to happen, Dr. Scott, in regards to the baby's behavior and its development. Why don't you talk to us about that?
Sure.
Establishing routines.
Sure. So at this age, babies, humans in general, are creatures of habit. We're comfortable doing the same things the same way, the same time, every single day. And that includes your newborn too. They anticipate things like bedtime routines. It helps them fall asleep a lot easier when they expect what's coming next. So if you do the same things in the same order at the same time every single night, it'll help transition your infant into bed every night. And it's the same thing with everything you do. Try to keep the same orders and the same routines for all of the feedings and everything else like that. It tends to help the babies with their anticipation and just their general social language and speech and communication skills. So the last thing that we do at these visits also, more vaccinations. So we expect 3 vaccinations at this visit. The first one is against DTaP, that's diphtheria, tetanus, and pertussis. The second is against polio, and the third is against hepatitis B. Do you expect any side effects from these vaccines?
The vaccines of today are pretty sophisticated and technologically advanced. You may expect some crying, some drowsiness, maybe a little lethargy, a little diarrhea or discomfort at the site of the vaccine. But in general, the babies do very well. I remember back early in my career where used to give the DTaP, and everybody always called it. The baby's fussy, it's cranky, it's feverish. We were fielding calls right and left. Now, I can't remember the last time I got a call on a vaccine. It happens like every 6 months to a year, one kid, and I'm not even sure if that's the reaction to the vaccine or just parental reaction. But the vaccines do prevent significant illness, which unfortunately I have seen in the past. Now, here's some nice pictures or gory pictures of diseases that we prevent. The first one, you have the hepatitis B. You can see the child is yellow, basically, because the liver is infected. Mm-hmm. Diphtheria is one of the diseases that I was fortunate not to see. Diphtheria, you can see it creates a thick, leathery covering in the back of the throat, and basically it obstructs the airway passages for the babies, and you can't breathe. Tetanus is one of those rare diseases that affects the nervous system, the third picture. And, you know, these are rarities because of vaccines. They just get spastic neurological seizure-like activity. Mm-hmm. It's a very, very bad disease, a disease that's transmitted basically through a rusty nail. Pertussis or whooping cough is still something that we see today. In a big kid, it's just a cough. They call it the 100-day cough, where they cough for a very long period of time. But the little babies, they go into that spasmodic cough where it can cause significant secondary complications, seizures, bleeding into the head, just from the violent coughing fits. Again, very, very small babies. And in the past, these children, the end result of these illnesses were hospitalization and critical care medicine. Now, because of these simple vaccines, you know, we just don't see them. So it's a great thing, vaccines.
Mm-hmm.
So please keep up to date on the vaccinations.
All safe, all effective. And if you have any questions or concerns about any of the vaccines, we are more than happy to sit and talk with you about them. We highly recommend these. If these presented any serious risk to the kiddos, of course, we would have that conversation with you. So thank you guys for spending some time talking with us here and watching this video. We're looking forward to seeing you when you come on in for the visit. Anything you need, feel free to give us a call. We are around 24/7. We have doctors on call all night long. Don't hesitate to call us if you need anything. You're never alone.